So we discussed both neoadjuvant and adjuvant strategies for advanced cutaneous squamous cell carcinoma, as well as emerging approaches using intratumoral therapies. One of the themes that came up was the emerging data around neoadjuvant approaches, both for melanoma and non-melanoma skin cancers, including cutaneous squamous cell carcinoma. And we discussed specifically some of the safety around neoadjuvant approaches using cemiplimab. Fundamentally, the data show that the safety of this approach is well recognized, and I think that was borne out in the clinical experience of the experts who were present as well, with the caveat that the data are still emerging, and we, unlike melanoma, lack randomized phase 3 data, which we hope to have in the near future to help us better guide decisions. In fact, we discussed some of the emerging data specifically for kidney transplant patients with respect to immunotherapy. In the phase 2 trial, the median age of the patients included was 79, so it's an elderly population. I think that was well recognized by the group, and the clinical experience is that these patients do tend to be older, often have medical comorbidities, and it can also have challenges in just logistics, getting back and forth to the clinic or to the hospital for treatments. So, these patients are likely the best to benefit from this approach. So specifically patients who have advanced, local regionally advanced disease that would require surgery and radiation, that can have quite a taxing role on their bodies and on their function ultimately. But they have to be resectable, right? So patients who are borderline resectable, and again, there's a risk of progression. So if patients are borderline resectable and advance to an unresectable state, that those are patients maybe less well suited for this. So older patients with locally advanced disease that would require multimodality treatment, these are the patients that we're generally considering and certainly would be looking to enroll in the randomized phase 3 trial.